those of us that have already registered and those who are at the registration area, may we invite you to sign up for the workshops along the registration area. There are 3 stations. Good morning once again. I would just like to join everyone this afternoon. There are 3 workshops and you have to sign up for any of these 3 workshops.
Kailangan nilang mag-sign.
Ay, napapabaya.
Lead me by the hand and make me feel the rising sun. Comfort me through all the pain that life may bring. There's no other hope that I can lean upon. Lead me, Lord. Lead me all my life. Walk by me across the lonely road that I may face. Take my arms and let your hands show me the way. Show the way to live inside your heart. All my days, all my life, you are my light. You're the lamp upon my feet. All the time, my Lord, I need you there. You are guiding light all through my life. Lead me, Lord. In the name of the Father, the Son, and the Holy Spirit. Thank you.
Ang magiliw, pelas ng silanganan, alab ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupig, di ka pasisiin, sa dagat at bundok, sa simoy at sa langit mong bughang. May dilagang tula at awit sa paglayang minamahal, ang kislap ng watawat mo'y tagumpay na nagniningning. Ang bituin at araw niya kailan pa may di magdidilim. Lupa ng araw ng luwalhatit pagsinta, buhay ay langit sa piling mo. Aming ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
Welcome everyone to the 13th Philippine National Immunization Conference and the 4th training course in vaccinology sponsored by the Philippine Foundation for Vaccination. It's a beautiful Wednesday morning here in the lovely city of Pines. And to usher in the sounds and the colors of the season, please welcome the students of the Baguio City National High School Special Program for the Arts for the opening number. with their teacher coordinator, Mrs. Marilyn Apiit, and choreographer, Ms. Merly Garcia. Another warm round of applause for the students of the Baguio City National High School Special Program for the Arts. And now, to give us the welcome address from the Honorable Mayor of the City of Baguio, Mauricio G. Dumogan, please welcome the Secretary to the Mayor, Mr. Rafi Talocoy.
The dance that you just saw was actually a welcome to all the participants to this program. The skirts used are those of Kalinga, while the men are of Bontok, like me. I sometimes do not feel okay when dances are done in those styles. Because I am more of the original. The mayor and I are more of the indigenous na talaga. There is what you call justice in their presentation. Choreographed kasi yun. Okay, and so one of the sins in public speaking is not to apologize, as I always say, but I would like to apologize for the non-appearance of Mayor Mauricio G. Dumogan. Right now, he is with the officers of the PEMSEA, the Philippine Mine and Safety and Environment Association. And at this moment, maybe he is at the Loacan Airport waiting for the arrival of the Deputy Minister of Minerals from South Africa. He will be the keynote speaker in the conference of the miners or the engineers for 4 days up to November 16. And so he sent me here to, just welcome you. And the dance already is supposed to be a welcome to all of you, including the statement of the Toastmaster. But anyway, the organizers of this particular program, the participants, the guests, if there are any, from the Department of Health, from PhilHealth, from the Philippine Foundation for Vaccination, and of course the Health Services Office. I see that some are here, like Mrs. Guanzon, including, of course, Mrs. or Dr. Prades Atanasio. She is the good wife of one of our assistants in the mayor's office. Of course, Dr. Bravo is here. And I would like to thank you really for making the city of Baguio as the site of your national conference. I am indeed personally happy for this occasion because I recall that a few days ago, you had the vaccination launching at the City Hall grounds. And then in the afternoon, I was privileged to judge the hataw laban sa pneumonia at the Baguio City National High School. And we had fun watching and judging the 3 participants or contestants. And I felt that I, was younger because of the movements of the participants. Another one was yesterday. I had also the privilege of joining Mrs. Bear of the PhilHealth. And the mayor also was there, and he talked about pneumonia, which is the subject matter of your convention today. But while we warmly welcome all of you to the city of Baguio, some of you were just asking me a while ago, the population of the city of Baguio, it's about 325,000 up, down, and about 1 million when the flower festival comes by February. We are of different nationalities, usually Americans before, but now the many people here are now Koreans. Koreans are now the more in number na foreigners. The city of Baguio, by altitude, is very high. It's the highest city in the Philippines, about 500 meters, feet above sea level, or 1,500 meters above sea level. We are now experiencing 15 degrees temperature. And so hindi pa nalalamigan yung mga yung mga sumayaw. Hindi pa sila nalalamigan. But as I was saying, while we warmly welcome you to the city of Baguio, there are rules to follow. One, of course, is anti-jaywalking, which is the more popular one, anti-smoking, anti-littering, and of course, to those of you who brought your cars, anti-smoke belching. And so comes the story of a man who tried to cross Session Road. And when he was trying to cross Session Road, a policeman saw him. And the policeman, di mo ba alam na prohibited o hindi pwede yung ginagawa mo? Hindi pwedeng tatawid sa kalsada. And so the man went to where he came from, and the policeman also tried to move away. And when the policeman turned his back, he saw the man crawling. Oh, I think, Doc, you heard this story. And so the policeman again ran towards the man and said, di mo ba alam na delikado yung ginagawa mo? Baka masagasahan ka. And the man said, ikaw naman, mamang pulis. Sabi mo, hindi pwede yung maglakad o tumawid sa kalsada. Kaya gumapang na lang ako. I hope there's nobody here from the province of Ifugao. That's an Ifugao joke. But anyway, again, we would like really to thank you for embarking on this kind of program. I was just vaccinated yesterday at the City Hall clinic because we reserved 10 shots for the personnel staff of the mayor. Kaya hindi kami nabakunahan sa lobby, kundi sa clinic yesterday. On a personal note, let me thank you really. When my daughter was hospitalized at the Baguio General Hospital, she was diagnosed of having emphysema. She was born with a congenital heart disease and at the same time asthma. And the doctors tried to really let her survive. They did what they can to let her survive. But of course, it's the will of God that she goes away. But let me share you the thought that lifestyle is a basic factor in terms of diseases, particularly respiratory diseases, including pneumonia. Smoking is one of the greatest factors, if not the greatest factor, in this kind of disease. The mayor had experienced TB, but he was treated of his TB when he was younger. Not that he was a smoker, but because of, the environment. And I would like to thank you for making a difference in the lives of other people, because you are treating people who are with this kind of disease, at the same time preventing people from having this disease. I am touched by the statement here in the paper, where great minds convene, dreams are shaped, and life is made sweeter. As a history professor at the University of the Cordilleras, I always say, after the Second World War, the United Nations gathered, and they had this statement: problems begin in the minds of men, and therefore it must be in the minds of men that problems must be solved. And I know that with your expertise in this line of malady, I know that the Filipino people would be better in terms of wellness or health. In short, I would like to again thank you for this occasion. I have to go to a particular meeting for the Christmas in Baguio, and at the same time, the Beach and Awards Committee. And so again, in behalf of Mayor Mauricio G. Dumogan, I would like to thank all of you. Mabuhay, may God bless us all. Baguio City is fun, or funnier, if you use the word funnier. And so I wish that you have more fun in the city of Baguio. No smoking. Thank you very much, and good day.
Very much, Mr. Talocoy, for your inspiring message and support. And now, ladies and gentlemen, to give us her opening remarks and the history of the Philippine Foundation for Vaccination, please welcome the President of the PFV, Dr. May Book Monteliano.
Good morning to all, to you, our distinguished guests, okay, leaders in the advocacy groups, colleagues in the health profession, ladies and gentlemen, again, a very good morning to you all. And of course, you know, when I was escorted, I said, sige, okay, senior citizen na kasi ako. So, usually I don't want to be escorted, just to feel that I am still okay. Okay? So, well, Charles Handy has said, and could not have said it better, that change comes from small initiatives, which work. Initiatives which, when initiated, become the fashion. We cannot wait for great visions from great people, for they are in short supply at the end of the history. It is up to us to light our own small fire in the darkness. And this is how the Philippine Foundation for Vaccination was first established in 2000. There were only very few people who took the challenge, and that is through Dr. Lulu Bravo, to start an advocacy campaign to promote vaccination as essential to disease prevention. We're now 12 years old, and PFB now finds itself continuously innovating in its campaign efforts so as to reach out and convert as many champions of health in the Philippines and around the world. Said around the world because PFB is not just a local organization. It has already given birth to some international organization. And this is your ASAP, and as well as the IPAP now, the immunization partners for Asia Pacific. Well, today, here in Baguio, we are undertaking the 13th Philippine National Immunization Conference and the 4th training course in vaccinology. This is the first time that we have brought PNIC outside of the National Capital Region, and we are very happy that we decided to do so because of the tremendous support we received from the local organizing committee, the city government of Baguio, the different health centers and hospitals in the region, and the many individuals and organizations who shared our vision of reaching the hard-to-reach populations in our country. PFB recognizes the innovation that alone it cannot solve the persistent problems of global health. Indeed, the scientific knowledge to prevent and control these deadly diseases already exists, and the solutions are cost-effective and easy to implement. The challenge has always been how to make this available to every child. To do this, we definitely need your help. So we hope that as we move forward from our 2-day conference, we will come out inspired and be able to consolidate our optimism about the prospects of eradicating vaccine-preventable diseases and direct our efforts towards sustained partnerships for achieving our ultimate goal of giving our children better health and better lives. Now let me go through the Philippine Foundation history. Okay, we started in 2000. And at that time, we had a very simple objective. Our objective then was disease prevention, no, through, awareness. However, as we have evolved this year, we've come out with a new objective. Because we've already attained, we've already started the program on making most of the people here in our country and the region aware of disease prevention through vaccination. Now we would like to sustain this program so that we may be able to reduce vaccine-preventable diseases and that we can come up to be a healthy nation. So that is the main objective now of our organization. Okay. So, who are we? We are a non-stock, non-profit organization. So we've survived through these years, through donations, okay? And, this has made the organization commit to improve the overall quality of our people, through vaccine information campaigns that we've been doing. This is what your hataw galaw, or yun also as well as your lakad in the morning, the walks that we make for it, the tri-media that we try to involve and have all these things be disseminated, and also have professional development. And this professional development is exemplified by what we are going to do today, the 4th vaccinology course, okay? And the product and the conduct of various outreach programs. What are these outreach programs that we've done? We've been giving vaccines, just like what we did in the lobby of the Municipal Hall of the city of Baguio. We've done this also for the government of Pasig, Pasay, and in so many other places we've done this. Okay, and this is how we did it. Okay. Now, the story, of this thing, how really this came about and why Dr. Bravo thought of maybe we should really disseminate the message that everybody should be aware that there is a way to prevent diseases. And there is a very simple way, and this is through vaccination. And this happened through one event that occurred at PGH. Okay, a pediatric resident who was at the signed at the NICU developed an infection and eventually infected all the different staff in that area. Okay, so infected also the other residents and ultimately infected the newborn there. So this has moved on, and this infection did spread at UPPGH, and this diminished, the workforce. So within 2 weeks, the workforce was down by 25%. So that's why, when this happened, so say, what can we do in order to control this? We've been doing this. It's just like an outbreak. It's an outbreak in the nursery. We've had an outbreak of measles since 2010, and we addressed it and controlled it through vaccination. And so that is why, because of this, thought of to come up with the Philippine Foundation for Vaccination. Okay, well, that was very fast. I'd like to show you. Where is it? There. These are the pioneers. So we've had through the years, the first president we had was Dr. Alicia Temesis, Dr. Bravo, and then Dr. Eric Tayag. the Assistant Secretary, my predecessor. Okay. So these were the people who started the Philippine Foundation for Vaccinations, and we involved also individuals who want to make this program of ours be spread, and one of them is also a celebrity, and she is Miss Lani Mercado. She was the first treasurer we had at that time. So these were the people who started it, and those that are not doctors are partners from the vaccine industry. Okay. So the target, audiences for the disease prevention through vaccination, which, targeted the media through Tri-Media. Then we also had parents. We involved the parents. We had the professional societies like the Philippine Pediatric Society, the Philippine Society for Microbiology and Infectious Diseases, to be involved in this advocacy of ours. And of course, through this, we've also involved some policy makers. So we have now in our midst, okay, Dr. Dukusin, who is the NIP, okay, the National Immunization Program Manager. We also have had Dr. Lyndon C. for our influenza. And then now, we also have Dr. Suzette Lasso, who is here with us, who's going to give a talk on vaccine safety. And so these are the very people that we really are targeting so that we can spread the word about disease prevention through vaccination. Okay. The very first project we had was, of course, involve everybody, called media, let them know everything, and then after which we came out with our own newsletter, the Bakuna newsletter. So this was the very first, for media that we had, engage a media group to come out and help us with this thing. So what we do is that we have vaccine information campaigns, just as I've said, professional development programs, and outreach programs. Okay. Vaccine information campaigns this is to increase public and professional confidence in immunization. So we spread the word that vaccine is safe, it is immunogenic, and it is efficacious. But we always come out with transparent and balanced, information. We don't hide anything. We always say that even though if it's safe, vaccine do not have a 100% safety. Okay, it's not 100% safe. Neither is it 100% immunogenic. So you just have to weigh the benefits and the risks in the use of these vaccines. So we come out with a really very transparent message to all of those whom we would like to engage in this campaign of ours. So these are the different immunization conferences that we've had through the years, and this is also where we present all the different new data that we have for vaccines, new vaccines that have been developed, what are their use, and also our recommendations for the different schedules for the coming year. So this is where we tackle all the problems regarding vaccines. So, and this is one of the outputs that we have in the National Immunization Conference. This is a childhood immunization schedule, and we also have an adult immunization schedule. The childhood immunization schedule is prepared for us by the Pediatric Infectious Disease Society of the Philippines, and it is PPS who approves, and Philippine Foundation is the one responsible for disseminating all these things. Okay. Now, for the adult immunization, this is done by the Philippine Society for Microbiology and Infectious Diseases, and again is disseminated by the Philippine Foundation for Vaccination. So you will see that the 3 logo that appears on the immunization schedules that are printed and given out have PPS, PIDSP, PFB there. And then for the adult, PISMID, okay, and PFB. Okay, so these are the things that we have. Okay, so, and we also have a schedule for healthcare workers. This is also prepared by the Philippine Society for Microbiology and Infectious Diseases. Okay, professional development so that in the pursuit of responsible vaccine advocacy, providing support for educational activities, programs, and partnerships. These are the different vaccinology courses that we've undertaken. There's our 4 already. We've also given grants, research grants, and support for our fellows in the pediatric infectious disease. Okay. And the outreach programs that we've done in order to increase access to immunization. And these are the different vaccine missions that we've done through the years. Okay. Okay. So now we are institutionalizing our pains by stepping up our contribution to the global immunization advocacy. And so we do have Asian Vaccine Conference since 2009 and brought this over to Cambodia. Of course, we had it here also in the Philippines when Vietnam was not able to sponsor it. And then Indonesia was last year. Okay. So then we had the diarrhea, the Asian Conference on Diarrheal Disease and Nutrition here, also in Tagaytay early this year, where rotavirus vaccine was announced and a ceremonial vaccination was done, and we were announced to be the first country in Asia to put rotavirus vaccine in the National Immunization Program. Okay. So then, last June, we had the immunization partners in Asia Pacific, and this was launched in Bangkok, Thailand. So we're really global now. We're not just local, no? So we influence public policy for immunization. We've had Hep B at birth, no? Which we have passed. I have been able to lobby to pass it as a law. Okay? These are the different signatories for the Hep B at birth. Okay? And then we had also the HIV vaccine in the National Immunization Program last July 2010. Okay? And then, as I've said already, the latest is rotavirus vaccine in the National Immunization Program last January. So, PATH came out with this PATH news that we were the first Southeast Asian country to have rotavirus in its National Immunization Program. Okay. So, helping raise awareness around the world against vaccine-preventable diseases has been done also through our association with Conference of Meningitis Organization, in which case we held last April the World Meningitis Day here also in Baguio. Okay. So, these were the different activities that we've had. We've come out with some booklets, you know, for information about meningitis. Okay. And then, of course, we're involved with the World Pneumonia Day. So, these are all the different pictures that will show you of the different activities that were undertaken during the World Pneumonia Day celebrations that we've had. Okay. So, we also have had the first Hataw Galaw, you know, contests that show the theme of the World Pneumonia through an interpretative dance to protect, prevent, and treat pneumonia. So we've had that. Okay. Okay, I would like to show you what has happened last Monday, and this is there at Session Road, okay, for our walk for pneumonia. Okay, this is it, just to show you where we've gone here in Baguio. And we've had that vaccine mission. So today, these are the different people who are responsible for running the Philippine Foundation for Vaccination. And these are the different officers and committee chairs. And these are our partners who have been donating to us, responsible for all the donations and the help in promoting our advocacy. Okay? So last, I would just like to invite everybody to attend the Asian Vaccine Conference, which will be held in Cebu in June 12 to 14, 2013. Please calendar this so that you can be part of the people who's going to spread this advocacy of ours of disease prevention through vaccination. Please, you may join our organization. There's really lots to do, and we need all your help. Thank you.
Thank you very much, Dr. May, for walking us through the history and the activities of the PFB. And now to give us the overview of the 13th PNIC, please welcome the overall chair of this convention, the woman of the hour, Dr. Senia Jaramillo Fabay.
It is with heartfelt and great pride that I welcome everyone to the 13th Philippine National Immunization Conference and 4th training course in vaccinology. Again, let's clap for ourselves for being here today. Indeed, the Philippine Foundation for Vaccination is true to its mission vision to be champions of disease prevention through vaccination for a healthy Filipino nation by bringing this conference to vaccine advocates at the regional level, the first of a series, and I repeat, the first time the PNIC comes to a region, and that is the first time the PNIC goes out of Manila. We have therefore prepared for you topics that range from basic vaccinology to updates on new vaccines by local and international experts from the many disciplines involved in the field of immunization. We have also prepared workshops where you can express your issues and concerns, and at the same time maybe come up with possible solutions and bring them home to your workplace. Prizes are at stake. We have some mechanics of the Brain Vac Challenge in your kits. Please read them. Every now and then questions will come up in our screens, and for those who will have the top scores, we have prizes. Also, for those who will be completing their feedback forms for day 1 and day 2, we also have prizes for them. Unfortunately, the Honorable Secretary Enrique Ona cannot be with us today. However, we have a surprise keynote speaker who is equally passionate and knowledgeable. Furthermore, today, November 14, will highlight the opening of the Baguio Country Club Christmas Village just in front of or across this hotel, and also the inauguration of their green garden. Everyone's commitment and dedication in furnishing continuous enhancement of knowledge and skills in the care of Filipino citizenry only shows sincere support to the nation's mission to promote the health status of each Filipino. Kudos to the untiring and dedicated members of the organizing committee. Please, a big hand for them again. The officers and board of the Philippine Foundation for Vaccination. Please, again, clap for them. For their relentless and passionate efforts to make this endeavor an overwhelming success. We have at the moment more than 250 registrants, that's including on-site and pre-reg. Dr. Bravo, are you happy? Dr. May? Well, while we are all at it, please enjoy the cool breeze of the ground city of pines. And may we never forget to thank the Lord, the Almighty, for yesterday, for today, and for every day. God bless us all, and welcome.
Closes our opening ceremonies, but before we begin nourishing our minds, we shall pause to nourish our bodies with a coffee break. Meantime, may we invite the officers of the PFB, our guests, participants, to join us for the opening of the commercial exhibits. Our sessions shall resume at exactly 10 a.m. Thank you very much.
Yeah, pero dapat you should come out and then diba?
Vegetable.
Okay lang po. Wala pa daw.
Bagyo, nakatanti conference ko kami almakuta. O, may lamang kayo.
Sige, takbo mo, aantayin ko. Hindi naman siguro hahating librahin at syempre maaga pabukas eh. Tapos hindi ko pa alam, mag-usap. Kasi mahingat.
What did you report na? Yung may dinig. Garcia. Garcia mo?
Ano yan, doktora?
Ano mo address po?
Kaninang mga doktor.
For seats, we shall be starting our program in 5 minutes.
Ano naman yung naka-vaccine ba yan?
Ano siya, Ursiflora daw.
Oo.
Once again, and again, thank you for being here today. Indeed, your presence here makes us all one step closer to eradicating vaccine-preventable diseases for a healthier nation. The main objectives of this conference are to provide a comprehensive training course on the basic principles of vaccinology, as well as to discuss current and pressing issues related to vaccination. Our first speaker is a well-known pediatrician and infectious disease specialist, recognized both locally and internationally for her passion for child advocacy and disease prevention through vaccination. She finished her Doctor of Medicine, Pediatric Residency, and Infectious Disease as a subspecialty at the University of the Philippines College of Medicine and the Philippine General Hospital. She had further Pediatric Infectious Disease Fellowship at the University of Texas Southwestern Health Science Center at Dallas, USA. She is a full professor at the UP College of Medicine and has designed and published over 20 pediatric instructional modules, manuals, and handbooks. She has also written chapters in the textbook of pediatrics, as well as helped produce teaching scientific videos on various infectious disease topics. Our speaker is currently the Vice Chancellor for Research and the Executive Director of the National Institutes of Health at the University of the Philippines, and is the Executive Director of the Philippine Foundation for Vaccination. She's the President of the International Society of Tropical Pediatrics, the Chair of the Strategic Alliance for Pneumococcal Disease Prevention, and the immediate past President of the Asian Society for Pediatric Infectious Disease. Ladies and gentlemen, to speak on the history and value of vaccines, please welcome Professor Lulu C. Bravo.
Thank you very much, Dr. Liz. Ang tawag nga namin kagabi, Excellent Liz Gallardo, Head of the Scientific Committee. Ladies and gentlemen, I am a little bit reluctant to give this lecture because I'm going to lecture, I know, to a group of people who I'm sure have already imbibed the value of vaccination. People tell us that we should be talking to people who may be anti-vaccines, you know, those people who really don't think that we should vaccinate children. But what I would like to really tell you more about today is really the value of communicating what you know to others who may still be unbelievers. And the way to go is really, okay, it doesn't work. The way to go is really to try and get what you will be able to see on here in this podium, in this session, and the 4th Vaccinology course and the 13th National Immunization Conference, to really try and communicate this to our colleagues. I'm supposed to give you the history. Vaccination has been here, more than 200 years, since the time of Jenner, who started the smallpox, getting the cowpox given to small boys. He was in fact condemned at that time. There were so many people who said, "You are crazy." But time has proven them wrong, because in the last 200 years of vaccination, public health and the safety of many, many children, the survival of many children has been credited to vaccination. In fact, in the world today, 95% of the impact on public health and on the health of every individual has been attributed to vaccines. You may not know it because you survived, but there were many, many, many who died who were not given the vaccines, who were not given the intervention, the measure that could have saved their lives. This is the time of Jenner, and definitely, as we said, started with the smallpox, and right now we know smallpox has been eradicated since more than 30 years ago. And we attribute this, of course, to the father of vaccine, Edward Jenner, and the people who followed him, Louis Pasteur, Charles Maroux, and down the line, there were so many. We could discuss this for many, many hours, but the bottom line is there is that value of vaccination. And maybe you cannot realize it, but vaccines do not save lives. It is vaccination that does. You cannot just put the vaccines on the shelves and say, okay, these vaccines will save children. No way! You have to put that vaccine into the arms, into the bodies of these children. And it's not only children. It's also the adults, yes, Dr. May. It's also the elderly, yes, Dr. Shelley. It's also the teenagers. It's also the healthcare workers, you who are doing patient care. Did you know that if you don't get influenza vaccination, if you are in any of the institution in the United States, you should be wearing a mask when you treat or when you handle patients. Because you, as a health worker, can transmit disease. And if you are not vaccinated, you can actually cause harm to the patient you take care of. So now there is a policy going around that influenza, in fact, can be prioritized not just to pregnant women, not just to elderly, but more so for healthcare workers. But many of us do not know that. Many of us do not realize that we as healthcare workers should actually protect our patients through vaccination too. So, ladies and gentlemen, we have known that there are more than 2.5 million children dying every year from vaccine-preventable diseases. And it is a process that needs to be made aware of to all of our people. The value of vaccine is not easy to sometimes spread because people think that just because they're healthy, they're actually feeling good, that they won't need vaccination. In fact, if I remember right, Ning Villa is here. When we were starting, where's Ning Villa? There you are. One of the great pillars of influenza policy in the Philippines today. She was one of those who worked hard for the disaster preparedness plan. And you know that the disaster preparedness plan includes flu vaccination. Because if a country starts to have avian flu, you cannot leave that country. You cannot get anyone back into that country. So a disaster preparedness plan for avian flu, for example, includes flu vaccination, especially to healthcare workers. So I'm just feeling that I cannot see my slide over there because May, you're right. You can't see my slide. You can't see your slide over there. And I have to really work hard to see that here. Yeah, maybe I should get down. But let me just tell you that we need to consider the Millennium Development Goals. Number 4 Millennium Development Goal is to reduce mortality, morbidity in children below 5 years of age. And as I said earlier, 2.5 million children are still dying every year from vaccine-preventable disease, especially from pneumonia and diarrhea. And now we have some ways and means to really save those children, if only we have our policymakers and even among ourselves pursue and sustain efforts to influence our policymakers to demand and prioritize vaccination. We now know that, in fact, I can't see it really. We now know that there are at least 26 vaccine-preventable diseases now. 29. Thank you, Dr. May. 29 vaccine-preventable diseases now. We know we have eradicated smallpox. We are in the verge of eradicating polio all over the world. They thought it will not happen, but it will. India has just been declared polio-free for at least 1 year now. And with India there, all the 3 others should follow. That's Nigeria, Pakistan, and Afghanistan. They're working hard to eradicate polio. And pretty soon it could happen. And when it does, it will be another landmark decision, another landmark event for the whole world. And down the line, years will tell us that all this have been reduced. Tetanus, diphtheria, pertussis, meningitis from HIV, from the US, from the developed countries. But still, the developing world is far from reaching some of the goals that the vaccine experts, vaccine advocates would like to have. You know, I'm going to diverge a little if I don't see some of these slides, but we know that many of these diseases have been reduced almost 99 to 100% reduction, and includes measles, mumps. Where's Joyce Ducusin? I was saying that Joyce, our EPI manager, there she is. You should be awarded because of the measles elimination drive that the Philippines has successfully launched in 2004 that removed the deaths from measles in 2004 and 2005. And we salute the Department of Health for doing that. And the world should recognize that, because still in the world, measles is one of the killers of children, together with pneumonia and diarrhea. But in the Philippines, we are lucky to have people at the Department of Health really pursuing vaccination. From the time of Lavier and from the time of people who worked hard and prioritized vaccination, we should be grateful for them. So I will just breeze through this. We know that vaccine will have benefits, not just to individuals, but more so to society and more so to economics. Vaccination is wealth. You should listen to our health economics. We should listen to the fact that vaccination can be producing productive lives, and therefore this will translate to better wealth for the country in the long run. They say that those who do not care for the children who suffer from chronic diseases, pneumonia, diarrhea, do not care for the future. And that's a really lamentable fact. But in the Philippines, we are happy to note that our Department of Health has that prioritization that you will know more about when they announce in the future what they have in store for us in terms of vaccination. Because indeed, vaccination is good for our individuals, for the society, and for the economy. And as I said, those deaths can be prevented. Those, says 26 disease, Mama May, so 29 diseases that are vaccine preventable could be there. And of course, herd immunity means that even if you vaccinate only the children, the adults could also be protected, just like what happens to APCV, or pneumococcal conjugate vaccination for children in the United States, in Europe. They have proven that there is herd immunity. And even for rotavirus, there is proven benefit to herd immunity, meaning those who have not been vaccinated also benefit because 90% of the population have been vaccinated. So I will just again try to figure out how I can read the slide, because I cannot. And actually, what we just need to show you are some of the things that will benefit our children. With high coverage, you have high herd immunity, and with completeness of immunization, that's the task of Dr. Joyce Ducusin, to make sure that our vaccine coverage reaches at least 90 to 95%, so that we can actually reduce all of these diseases if we have a minimum vaccination coverage of 80 to 95% for measles, diphtheria, polio, pertussis down the line. And of course, I just want to let you know that we are also inclined to think of vaccination ethics, which respect the rights of others, to really say, I don't want to be vaccinated. But our responsibility is really to convince them, to say that vaccine must be given the chance to be proven, to have beneficence, to have not harmful, non-maleficence. There are justifiable benefits to vaccination, and of course, autonomy means that you have the right to do what you think is right for yourself or for your children. Autonomy. You cannot really say that you have to force somebody to be vaccinated. But I would rather that we convince them of the value of vaccination. That's how we look at ethics in vaccination. The success of vaccine is the basis for complacency and anti-vaccine stories. And many times, because people forget that there were polio a long time ago. There were a lot of disabled people. There were a lot of deaths from meningitis, from diphtheria, from tetanus. They forget that now is the time to think that we still should sustain those immunizations. People think that one episode of an adverse effect is proven to be vaccine-related, and they think that people should really stop vaccination. No way. We should continue our efforts to make sure that these vaccines are given and that whatever questions arise from vaccination can be answered by all of you here if you become a vaccine advocate. Because before you can become an advocate, you must convince yourself first. Change must come from within you. So those of you who think that there are still questions, keep on asking, keep on researching, keep on doing what it needs for you to be convinced. And once you are convinced, I'm sure you will join our Philippine Foundation for Vaccination with all this group of people to be part of a bigger global effort to spread the word that the decade of the vaccine is now within us, 2011 to 2020, which was endorsed by the World Health Assembly last 2011 and repeated this year, to make sure that countries will prioritize immunization, individuals and communities will demand vaccination, and that vaccination will be equitably distributed to everyone, rich and poor, and that it will be integrated into the healthcare system, and that it will be sustainable, and that there will be innovation and various researches that could bring about changes and better vaccine coverage for our people. With that, I would like to tell you that I am so grateful that you are all here, and thank you very much for having us.
May we now invite on stage Dr. May Montellano and Dr. Senya Fabay for the awarding of the Certificate of Appreciation.
This is family, but we recognize each other always within the family. Thank you.
Full Professor of Pediatrics at the FEU Nicanor Reyes Medical Foundation. She is also the head of the Department of Pediatrics of Mary Child's Hospital and a member, Board of Trustees, and co-director of CME and Training of the Philippine Pediatric Society. She is the Vice President of the International Society of Tropical Pediatrics, past President and Advisor of Immunization Committee of the Pediatric Infectious Disease Society of the Philippines. She is the Chair of the Hospital Accreditation Board and co-chair of the Adult Immunization of the Philippine Society of Microbiology and Infectious Diseases. She is a pediatric infectious disease consultant at San Lazaro Hospital, a fellow of the PPS, PIDSP, and PISMID. Ladies and gentlemen, to give us our next lecture on the basic principles of vaccination, how vaccines work, please welcome back the President of the PFV, Dr. May Book Montellano.
Again, good morning to all of you. But since I cannot read the slide, I will just have to go down and stay on the ground so that I can read the slides. I am not on the value of vaccines. Okay, she said that, that the vaccine to provide a good or optimum protection has to have a high coverage. Okay, how do we have the coverage, the percentage of coverage there range from 80 to 95. But do you know that she mentioned Dr. Dacusin as the National Immunization Program, who's responsible for public health, and for the public to have the vaccines. The public is just, when you compute it, divide the population, 70% are the poor, or maybe those that are addressed by the government, and about 20%, 70 to 80 is covered by the government, and 20% or 15% by the private sector. So if you're just going to give give the vaccine only to 80% of the population down the line, you're not really going to have a very good coverage. Okay? And that's why I mentioned to Dr. Dacusin, I'm mentioning this before I talk on how vaccine works, is that I would like everybody to know that the vaccine provided by the government has been computed for the whole population, susceptible population. So that means to say if our birth cohort is 2.5 million, all those 2.5 million has already been computed to receive the vaccine. Okay? So private or public should avail of that vaccine. It's not only intended for the barangay health centers. You, the private sector, can get the vaccine from the government, and it is for free. And some of you are reluctant to get it because some are saying it competes with the vaccine that they are providing. And therefore, since vaccines are mostly the bread and butter of most of the pediatricians, they're so afraid of it. Please don't be afraid because you're allowed by the government to charge for handling, storage, and administration of the vaccine. The vaccine is for free. So let's help the government because if they're going to give it only to the barangays, then that doesn't cover for the whole susceptible population. So please help. No? We do have the vaccine. Vaccines that are in the National Immunization Program are intended for everybody, for those who needs it. So please, that is just my appeal to all of you. But please remember that although the vaccine is for free, given by the government, intended for those of the poor, but they are also intended for the rich. Be poor or rich, they are all covered by the computation of the government to receive the vaccine. So please, the private sector, get your vaccines for the DPT. No? Our DPT now is the combination DPT. So you have the diphtheria, tetanus, pertussis in combination with Hib and Hep B. So that's we are already leaning towards combination vaccines. So I'll be talking on that, on how vaccines work. Okay, so let me start off by starting with basic principles of immunology. I know you've gone through this in your med school, but let me just refresh you about it because there are some who may have, forgotten about all these things. So we start off with some definitions. And, when we say immunity, when you ask somebody, are you already immune to the disease? Everybody knows that. They will say, resistance to the disease, okay? So resistance to the disease is the definition for immunity, okay? Mostly for infectious diseases. Now, the immunity, this immunity or this resistance to the disease is born from the interaction of what we call the immune system. The immune system consists of cells, tissues, and molecules, that are supposed to mediate the resistance to infection. So when these things, when the antigen or the infecting agent together with the cells, the tissues, they interact, there is a response. And the response towards the antigen will be now known as your immune response. So this is the collective reaction of these cells and molecules against the infectious agent. Now, the study of the immune system and its responses is known as immunology. Okay? So, the physiologic function of the immune system is to prevent infection and ultimately to eradicate an established infection. Okay. Now, the immune system is really a complex system. It consists and identifies what is self and non-self. Okay, for vaccination, it is supposed to recognize what is non-self, not his own. Because if it is self, then that's an autoimmune disease that will occur. Okay, but for a non-self, the body recognizes the antigen, which is your vaccines, no? Then you will have a response towards that. Now, these antigens can be live or inactivated antigens. I will expound on that later on. Okay. So when the interaction occurs, or the cells identifies the foreign substance in the body, which is your antigen, an immune response will be mounted. Okay, so the production of protein molecules is now known as your antibodies, the production of your antibodies, which are your immunoglobulins. So your immunoglobulins consist of IgM, IgG, IgA, IgE, and IgD. So those are the immunoglobulins that are produced. And then there are also the production of specific cells. And this goes on to induce what is known as cell-mediated immunity. Why it's called cell-mediated? Because it is through cell-to-cell interaction. So all of these responses facilitates the elimination of foreign substances. Okay, when we vaccinate, the response to the vaccine is just like a natural exposure to an infection. So the response to the vaccination is just as if you got the infection itself also. Okay? So it mimics natural infection. So what happens is you have a natural immunity. Now, the natural immunity can be based on what's known as an active and a passive immunity. So when you say active immunity, this is the immune response generated by the body against an infecting agent. It induced, you were exposed to it, you got infected, and you got the disease. Okay? So after the disease, when you recover, then you develop immunity against that disease. Now for passive immunity, this is when an individual gets the infection, mounts an immune response, especially like humoral immune response, and since a female gets pregnant, now the antibodies within that mother against previous infection like from measles will be passed through the placenta to the fetus and then to the newborn. And then the newborn gets these antibodies and gets protected from the disease. Okay, so that's what we call passive immunity. So when it passes through the, or when it crosses the placenta, then that's called passive immunity. Okay? Now there is what is also known as your artificial immunity. And this is through vaccination or through the giving of your blood products, okay, and immune globulins. So the equivalent of the natural immunity that induces passive immunity is that when you give the vaccine, you inject the antibodies. The antibodies are already preformed antibodies. Through that, you are able to give protection, immediate protection to the individual who have been exposed to the disease. So it's an immediate protection that is provided. Okay? Well, I mentioned already the active. Okay? For the active portion of the artificial immunity, this is now induced through vaccination. So you inject the antigen. So you have an antigen. What is this? Your vaccines. These are your DPT, diphtheria, tetanus, pertussis, okay, Hep B, HIV, HPV, MMR, varicella, and all of these vaccines. These are antigens. They contain antigens, no? Part of the organism that can induce protection. And this is through vaccination. And this is what we call active immunization. Okay. So, let me review the immune system. We do have two arms of the immune system. You have the innate and you have the adaptive. So the innate is really non-specific. Innate, what we have, the skin, the surfaces, the gastric juice, and all these things are innate in nature, no? The protection supported for that. But these are non-specific. So they are not specific for one organism alone. So they induce or they mount also a humoral, but not specific for a single antigen alone or infection. So humoral and cellular. So the humoral is mediated by a chemical mediator known as your cytokines, which induces inflammatory reaction in order to be able to control the infection. Okay? Cellular, we do have the cellular portion is based on the presence of your phagocytes, which induces phagocytosis, you know, and then mast cells that are there, and the macrophages. So you very well know that when one has a respiratory infection, there are alveolar macrophages, and they are the ones that are responsible for controlling the infection through the action of this, but they are non-specific. They do not just recognize whether it is a viral, it is a bacterial, or what. So it just is mounted because it's there. So the adaptive one is the one where it adapts. That's why it's called adaptive, because the response that is generated from it is very specific. So specific in the sense that you get a specific infection, and a humoral immune response is generated specifically only for that organism. Okay? So these are because of your B cells antibodies that are produced. Okay? And then for the cellular immune response, this is because clones of specific T cells, which are, you have what is known as your helper T cells, as well as your cytotoxic T cells. They are the ones responsible for the adaptive immunity. Okay? So the first line is your innate, it's usually non-specific, and the second line is your adaptive. So just at the bottom, please remember that, as I've said, it is non-specific, therefore there is no memory towards a specific infection. But because the adaptive is mounts a very specific immune response, it has a memory. There are clones of cells that are produced once the infection is there, or once the vaccine has been given, and through the years, on second encounter, they will be mounted as fast as possible in order to control or protect the individual from subsequent infections.